Behavioral learning theories explain the acquisition, strengthening, weakening, and shaping of behaviors within different contexts through several mechanisms. Classical conditioning by Ivan Pavlov. Ivan Pavlov's classical conditioning theory demonstrates how behaviors are learned through associations with stimuli. For instance, he showed how dogs learn to associate a bell with food, causing them to salivate at the sound of the bell alone. Operant conditioning by Boris Frederick Skinner. Boris Frederick Skinner's operant conditioning theory focuses on how behaviors are influenced by their consequences. Skinner introduced concepts like reinforcement and punishment to explain how behaviors can be encouraged or discouraged based on their outcomes. Observational learning by Bandura. Albert Bandura's observational learning theory emphasizes the role of social observation and imitation in acquiring behaviors. His research demonstrated that individuals learn behaviors by observing others and the consequences of those behaviors. Let's explore each mechanism more in detail. In 1927, the Russian psychologist Ivan Pavlov first described the theory of classical conditioning. Classical conditioning involves a type of learning where a neutral stimulus becomes able to elicit a response after being paired with a stimulus that naturally provokes that response. Pavlov's research demonstrated that stimuli that were initially unrelated could evoke reflexive responses through this association. Pavlov's groundbreaking experiments primarily involved dogs, where he investigated how a neutral stimulus, such as a bell, could become a trigger for a reflexive response, like salivation, after being consistently paired with a naturally occurring stimulus, food. Initially, the bell had no effect on the dogs. However, through repeated pairings with food, the bell eventually elicited salivation even in the absence of food. This process demonstrated how a neutral stimulus could acquire the ability to evoke a response through association, a principle now known as classical conditioning. In practical terms, classical conditioning underscores how environments and experiences can influence emotional responses and behaviors. For instance, a child's first visit to the dentist can evoke anxiety and fear due to the association of neutral stimuli, like the doctor's coat, dental tools, with potentially uncomfortable or painful experiences like injections or dental procedures. Over time, these neutral stimuli can become conditioned cues that trigger emotional responses, such as crying or withdrawal, upon encountering similar environments or cues associated with medical settings. Understanding these associations allows dental professionals to implement strategies to mitigate anxiety and improve patient experiences. Techniques such as gradual desensitization, where patients are gradually exposed to dental procedures in a controlled and supportive environment, can help in breaking negative associations and reducing fear responses. Moreover, creating a positive and calming environment in dental clinics through soothing decor, friendly staff interactions, and clear communication can help in establishing new, positive associations for patients. By applying principles derived from Pavlov's experiments, dental and orthodontic professionals can effectively manage patient anxiety, enhance treatment compliance, and improve overall patient care experiences. Acquisition. This refers to the initial stage where a neutral stimulus begins to evoke a conditioned response. For example, salivation in response to the bell. Generalization. This occurs when similar stimuli to the conditioned stimulus also elicit the conditioned response, like salivation to similar sounds resembling the bell. Extinction. When the conditioned response diminishes or disappears due to the lack of reinforcement, like the bell no longer followed by food leads to a decrease in salivation. Discrimination. This involves the ability to differentiate between the conditioned stimulus and other stimuli, for example, distinguishing between the sound of the bell and music and responding only to the bell. Classical conditioning exemplifies how associative learning shapes behavior and emotional responses, offering insights into how individuals adapt to their environments and learn to anticipate events based on past experiences. Operant conditioning, proposed by Boris Frederick Skinner in 1953, expands upon the principles of classical conditioning introduced by Pavlov. Skinner defined operant conditioning as a form of learning where behaviors are strengthened or weakened based on their consequences. Skinner coined the term operant to describe any active behavior that affects or operates upon the environment to produce consequences. Unlike classical conditioning, which focuses on involuntary reflexive responses, operant conditioning emphasizes voluntary behaviors that are influenced by their outcomes. Skinner highlighted the role of consequences in shaping behavior, suggesting that behaviors followed by positive consequences, reinforcement, are more likely to be repeated, while behaviors followed by negative consequences, punishment, are less likely to occur again. He also emphasized the unconscious determination of behavior, proposing that the consequences of actions themselves serve as stimuli that influence future behavior. One effective strategy is positive reinforcement, where desired behaviors are encouraged by offering a reward or a pleasant stimulus immediately after the behavior occurs. Imagine a child sitting calmly during a dental checkup and receiving a favorite toy as a reward. This positive reinforcement not only reinforces the child's cooperative behavior, but also establishes a positive association with dental visits. Negative reinforcement, another technique, operates by removing or avoiding an unpleasant stimulus when the desired behavior is exhibited. For instance, a child who tolerates discomfort during a dental procedure might experience relief as the procedure ends early. This encourages future cooperation by reinforcing the behavior that led to the removal of discomfort. Omission, often referred to as timeout, involves the removal of a pleasant stimulus or withholding of reinforcement to decrease undesirable behaviors. This method, while effective when used cautiously, aims to discourage behaviors that are problematic, such as tantrums or non-compliance during treatments. Finally, punishment is used to decrease the likelihood of a behavior by introducing an unpleasant consequence after the behavior occurs. It serves as a deterrent, discouraging behaviors that may be harmful or disruptive. However, due to its potential negative impact on emotional well-being and long-term behavior, punishment is administered sparingly in clinical settings. Each of these techniques plays a crucial role in behavioral therapy, carefully tailored to encourage positive behaviors and discourage negative ones, ensuring a supportive and effective environment for children's development and well-being. Operant conditioning principles are integral in managing behaviors in clinical settings, promoting cooperation, and reducing anxiety among young patients undergoing medical or dental procedures. Understanding these principles enables healthcare providers to implement effective strategies that foster positive experiences and encourage patient compliance. Observational learning, also known as modeling, was pioneered by Bandura. This theory posits that children acquire behaviors by observing and imitating others. It emphasizes two key stages in the learning process: acquisition and performance. During the acquisition stage, a child gains the ability to perform a behavior simply by observing it being done by others, without necessarily practicing it themselves immediately. This phase lays the groundwork for later performance. Once the behavior is acquired, the child moves into the performance stage, where they actually execute the behavior they've observed. The effectiveness of performance, according to this theory, hinges on various factors such as the child's preference for the behavior observed. If the child finds the behavior appealing or valuable, they are more likely to mimic and perform it themselves. Observational learning plays a significant role in managing dental treatments, particularly with young patients. When a child witnesses an older child calmly and cooperatively undergoing dental procedures, they are inclined to mirror this behavior. The younger child learns from the older child's example, fostering cooperation and reducing anxiety during their own dental visits. This theory underscores the powerful influence of role models and peers in shaping behavior, highlighting the importance of positive examples and supportive environments in children's development and healthcare experiences.